Imagine a calm room. The light is bright. The instruments are clean. With one small incision, you can make a safe and permanent change for a patient's life. Today, we will walk through neutering male dogs and cats. We will do this with care. We will do this with confidence. We will follow clear, safe steps. Castration is a foundational surgery you will perform. Mastering it builds skill and the right mindset, precision, safety, a deep respect for the animal in your care. Why do we neuter? Prevent unwanted litters, help control the pet population, reduce roaming behaviors, lower the risk of accidents and fights, eliminates testicular cancer risk, lowers chance of prostate problems in older dogs. In male cats, reduces pungent urine odor and reduces urge to spray. It's very common and very safe when done correctly. Before you pick up a scalpel, check the patient thoroughly. Get a concise but complete history from the owner. Perform a physical exam. Listen to heart and lungs for murmurs or abnormalities. Check gum color and assess hydration. Confirm both testicles have descended into the scrotum. If missing, note potential cryptorchidism. Cryptorchidism needs a different surgical plan. Let's talk about your tools. A standard castration pack is simple, but it must be complete and sterile. Scalpel handle. Scalpel blade number 10. Scalpel blade number 15. Hemostats. Delicate mosquito forceps for finer work. A pair of needle holders is essential. Sterile gauze swabs to dab away minor bleeding. Towel clamps to secure the drapes. Suture material. Absorbable for ligating and closing deeper layers. Position your patient correctly and securely. For dogs, dorsal recumbency, lying on their back. For cats, you can use dorsal recumbency like a dog, or lateral recumbency, lying on their side. A sepsis or sterile technique is non-negotiable. Your hands must be sterile. The patient's skin must be sterile. Your instruments must be sterile. Once scrubbed and gloved, do not touch anything non-sterile. If you do touch something unsterile, you break the field, re-glove. The standard approach for a dog castration is prescrotal. This means your incision is made just in front of the scrotum, not on it. First, you gently palpate one testicle. Push it forward subcutaneously so it sits on the midline, just cranial to the scrotal base. Hold it securely with your non-dominant hand. With the testicle held in position, make your incision. Using your scalpel, make a single, firm cut through the skin directly over the testicle. The cut should be just long enough to allow the testicle to be pushed out. Continue the incision through the subcutaneous tissue, then through the spermatic fascia. When you see the glistening vaginal tunic, you're in the right place. Apply gentle pressure so the testicle pops out through the incision. Clear the spermatic cord of excess fat and fascia. Identify the structures you will ligate: testicular artery, testicular vein, vas deferens. This is a closed castration. Do not open the vaginal tunic. Place 2 strong hemostats across the cord. First clamp, closer to the body. Second clamp, just distal to the first. With clamps in place, tie your knots. Place a circumferential ligature just below the top clamp using absorbable suture. Use a secure surgeon's knot, pulled tight. Once confident in your knots, cut between the hemostats to remove the testicle. Slowly release the clamp, watching for bleeding. If dry, let the stump retract. Repeat for the second testicle through the same skin incision. The feline neuter, a scrotal approach. Cat castrations are typically done with a scrotal approach, which is different from the technique used in dogs. First, confirm both testicles are present in the scrotum. Stabilize one testicle between your thumb and forefinger. Using a scalpel blade, make a small, bold incision directly into the scrotal skin, cutting down to the testicle. The incision needs to be just large enough to allow the testicle to be gently squeezed out. You are aiming to pop the testicle, still enclosed in its shiny vaginal tunic, through this single scrotal cut. Once the testicle is exteriorized, the closed technique means you will not open the common vaginal tunic. Instead, gently strip the fascia away from the spermatic cord to isolate it. This gives you a clean cord to work with. Take care not to be too aggressive. This can cause bruising and swelling. The goal is enough clear cord length to tie your knot securely. This step is often done with a dry gauze swab, using a gentle pulling motion away from the body. Now for the knot. In cats, you often use the cord itself to create a self-ligature, avoiding suture material left behind. One common method: separate the vas deferens and the testicular vessels, then tie them together in square knots. Another popular technique: an overhand figure-8 knot using the entire cord. Whichever method is used, the key is a tight, secure knot that will not slip. After the knot is tied, pull it firmly to ensure it is tight and will hold. Check carefully for any signs of bleeding. Once satisfied, cut the testicle off, leaving a short stump with the secured knot. The stump is then allowed to retract back into the scrotum. Repeat the exact same procedure on the other testicle, making a second separate incision. After the cut recovery, care, and final checks, the surgery is done, but your job is not over. The recovery period is just as critical as the procedure itself. As the patient begins to wake up from anesthesia, they must be monitored closely. Keep them warm with blankets or heating pads because anesthesia lowers their body temperature. Check gum color, check heart rate, check respiratory rate. Ensure they are breathing comfortably and recovering smoothly. Pain management is a cornerstone of good post-operative care. Your pre-medication provided some initial relief, but you will need a plan for the coming days. Before the patient is fully conscious, you must place an Elizabethan collar or e-collar. This is not optional. It prevents licking or chewing at the incision, which can lead to infection or self-trauma. You must give the owner clear, simple discharge instructions. For dogs, this means strict rest and leash walks only 10 to 14 days, no running, no jumping, no swimming. For cats, they should be kept indoors and encouraged to be quiet for 5 to 7 days. The owner needs to check the surgical site daily, look for excessive swelling, redness, discharge, a bad smell, or any sign that the pet is bothering the area. A small amount of bruising or minor swelling can be normal. Any large, hot, or painful swelling is a red flag that requires a call to the clinic. Let's end with a final safety checklist before the patient goes home. Is the pain plan in place and understood by the owner? Is the e-collar on and fitted correctly? Does the owner know all the aftercare rules and red flags to watch for? By following these careful steps, preparation, procedure, post-operative care, you ensure a safe surgery and a smooth recovery. You have performed a procedure that benefits the animal, its owner, and the community. Well done.